Hello viewers, you are welcome to Bioethics channel. So again, we are here to brainstorm on certain bioethical issues and challenges. These are issues precipitated by advancement in technology. We look at how they affect the human person and the entire ecosystem. So I remain your regular anchor, Pascal Chinaya Neke, PhD, University of Lagos, Nigeria. And on my left is...
I am Molai Bangura, a PhD candidate, University of Lagos.
And while I'm in philosophy, is in economics. So bioethics is a subject of many voices. We are going to have an interdisciplinary approach to the issue. So today we are going to look at what we call medical assistance in dying, also called medical aid in dying, MAiD. What is medical aid in dying? How did we come about this concept? How did it generate? Going from euthanasia, mercy killing, medical assistance in dying. So we have to look at the issue of medical assistance in dying. But look at our bulletin and see what it says. Then after that, we then look at the critical issues and matters arising. So let me read from our bulletin. Medical assistance in dying is a process through which a doctor, a nurse, a medical practitioner assists an individual at their request to intentionally end their life. The question of whether severely ill, suffering patients are entitled to a physician's help to end their suffering by ending their lives has been debated since antiquity. The Hippocratic Oath suggested that this was outside the physician's professional responsibility. But even in that time, there was considerable disagreement. In the modern era, there's consistent evidence of a secret practice of medical aid in dying in Western countries where it is prohibited. The medical profession and the law tend to look the other way, as long as it does not become public. Like, don't ask, don't tell. This secret practice was fronted in the 1990s when Jack Kevorkian assisted in the death of approximately 150 patients. Although he lost his professional license in the process, he was a pathologist, not a clinician. He was not successfully prosecuted until he provided active euthanasia at a patient's request and was subsequently jailed for over 8 years. So there are two methods of medical assistance in dying available, especially in Canada, for example. Now, method one, a physician or nurse practitioner directly administers a substance that causes death, such as injection of a drug. This is sometimes called clinician-administered medical assistance in dying. Like the medical practitioner injects a drug to the patient that will facilitate the process of ending one's life, that exits from this world. The second method is like a physician or a nurse practitioner provides or prescribes a drug that the eligible person takes themselves in order to bring about their death. This is sometimes called self-administered medical assistance in dying. And in that method too, the physician will prescribe a medicine that the person will take that will accelerate the dying process. So to be considered as having a grievous and irremediable medical condition, you must meet all the following criteria. In other words, there are conditionalities to qualify, because we are saying that an eligible person. Okay. So to be eligible for medical assistance in dying, one, the person must have a serious illness, disease, or disability. Two, must be in an advanced state of decline that cannot be reversed. They must experience unbearable physical or mental suffering from the illness, disease, disability, or state of decline that cannot be relieved under conditions that you consider acceptable. Or the patient is terminally ill, in excruciating pain, no hope of survival, and all those stuff. So you do not need to have a fatal or terminal condition to be eligible for medical assistance in dying. But under certain conditions, you don't necessarily need to have a fatal disease or a terminal illness. So let us look at what is that, why this is so. So if your only medical condition is a mental illness, you're not currently eligible for medical assistance in dying in Canada. Then if you have a mental illness along with other medical conditions, you may be eligible for medical assistance in dying. Look at the eligibility criteria. Then eligibility is always assessed on an individual basis and takes all relevant circumstances into account. However, you must meet all the criteria to be eligible. We say medical assistance in dying is a practice in which a physician provides a competent adult with mental illness, with terminal illness, with a prescription for a little dose of a drug at the request of the patient, which the patient intends to use to end his or her life. Medical assistance in dying currently is legal in 9 states and the District of Columbia. The most common concern leading to requests for medical assistance include loss of autonomy, one, loss of ability to participate in activities that make life enjoyable, and a loss of dignity. But in all, medical assistance in dying remains a controversial issue in bioethics. So let us examine these issues. Medical assistance in dying. Now we're no longer giving assistance to live, but assistance in dying. And yeah, even the Hippocratic oath is mentioned, where the physician takes oath to act in beneficence, to act in a way to benefit the ill persons, to heal, to alleviate suffering, not to kill. But medical practice is changing to the extent that it becomes an assistance in dying, not assistance in living. So let us examine this issue, Dr. Bangura. What is your take?
Yeah, again, medical aid in dying. I think it's a concept before we really, for me, go deep into the conversation of medical aid in dying. The question we need to ask ourselves, again, across societies, is our perception of life. If we are able to unravel or unpack the concept of how do we look at life, because in your intro, I think what you throw out basically is you are looking at the case specifically in Canada or the Western world. But then zoom in on the issue in Africa. Again, this is where culture and our perception of life comes in. In Africa, the way we see life, life is so sacred that to take any aspect of life, even the concept of aiding somebody to die, we see it as a crime, against humanity. However, there are situations in our tradition where we are confronted with family members who have gone through or who have been suffering some terminal diseases, and to some extent they've been bedridden for years. You understand? They've not been active, because when you are looking at the preconditions, for that qualifies for medical aid in dying, that conditions that can trigger or activate or to help facilitate that. And then one thing that comes out is we have been confronted with situations where we have family members, siblings, who maybe have been sick for, say, 10 years, bedridden, unconscious, they've not been doing anything, but at the end of the day, they become liabilities to families, and then they even erode the dignity of the family because they will be doing everything on themselves. But then the decision comes, do we continue to see them go through those pains, or do we really activate the medical aid in dying? This for me is a moral question. In Africa, you will say, no, morally it's not right to kill anybody. We'll allow that person to go through that natural cycle and then die. But then if you look at the human aspect of it, will you allow somebody to go through pain for 10 years, sometimes excruciating pain, without really you supporting that person to die? So for me, I look at this medical aid in dying as something that we can also see that we can incorporate into our society, except when those conditions are right.
Well, thank you for that contribution, Dr. Bangura. And when we look at the issue of sanctity of life, these are the medical assistance in dying. When does life lose its sanctity? When does the right to life or to preserve life, as we practice in Africa, when does it end? That we can then justify helping somebody to die as medical practice. Is it compatible with our cultural belief? Or is it going to be like superimposing Western idea into our African thought system that values life and continue to protect life, even at the terminal end, life still does not lose its value. But in this situation, we see that at the time, life begins not living. That's why we use medical aid, that medical assistance are supposed to help one to live, applying it to accelerate death. So is it compatible with our culture? How is it going to really fit into the African belief system?
For me, that is why at the outset I said it's a concept of how do we look at the life and the concept of the sanctity of life. But then in the African culture, we have to face the reality. There are situations where, Dr. Pascal, we even abandon the sick. We get fed up with them. You understand? Somebody is being sick for 5 years. It's affecting other people's economic life. Because you have to basically get somebody to sit down, to look over, to superintend over that person. You understand? But at the end of the day, it's not really worth it to destroying somebody's economic life just to see. So I think, although it's not compatible to our culture, but these are some of the things we need to incorporate into our culture. That is why I'm still insisting, when the condition is right. You understand?
Very implying that in the evolution of things, we need to adjust understanding and seeing that when it becomes a moral good, that see someone die, instead of remaining in that excruciating pain without any hope of survival, and the person will still end up dying. And the resources of the family will be expended, take care of the person, a futile medical effort.
That's my own view. You understand? Because culture in itself is part of an evolutionary process. You understand? It's not about saying, okay, it's Western. Let us we look inward. We look at some of the inconveniences that are caused by these situations and see where it will become morally right to trigger, you understand, the medical aid in dying.
I think when the issue of medical assistance in dying remains a controversial topic in bioethics, it also brings us to the issue of when does life lose its own sanctity, when we cannot cure. It brings us to the issue of medical fertility, and then what to be done. When we say that all medical effort will result in nothing, it becomes fruitless to continue treating, to continue spending on that person, then it becomes morally acceptable to end the person, to end his or her life. To still make it an open discussion that we keep revisiting and then begin to examine the matters arising from this practice and see how we can be understood within the African context. Thank you, Dr. Bandela.
Thank you, Dr. Pascal.